So this one, OML perpendicular, use 30, 37. If the IOML, centering 1 inch above the nasion. So go ahead and get straight. Try to get your OML. Put your head down just a little bit. So I'm going to use your IOML on this one. And so I'm going to do a 37-degree angle. So I'm using his IOML right there, and then it says center about 1 inch above the nasion. You see 1 inch above the nasion is going to go right through those arches right there. Good. And then on this one, I can kind of calm it down a little bit, top to bottom. And just trying to get those arches right there. Left marker.
And suspend breathing on all these. Okay.
Yeah, hold your breath.
Hold your breath.
Or mouth open or closed on some of these.
Oh.
So 1 inch. So IOML perpendicular, 1 inch above the nasion, going right through the zygomatic arch. All the way down to the little arch right there. Left marker. So a lot going on for the skull.
Yeah.
Nasal bones.
Is it hard with the mask?
P and J. Because
Okay.
you really you kind of know where things are. So first the mandible, PA, prone or seated erect, so I'm be standing. Adjust the nose and forehead to rest on the IR. OML is perpendicular. Anterior surface of the mandibular symphysis is parallel with the image receptor. The type plane should be perpendicular. So this is kind of like forehead and nose. OML perpendicular. It says center a perpendicular ray at the level of the acanthion for the body and the rami. So there's really two on the PA. To do the body, so to do the body and the rami, I center at the acanthion. Forehead and nose up against the board. Tilt your chin down just a little bit more. So OML perpendicular 2, and then I'm going to center at the acanthion. This up. So on this one, this is going to be for the rami and the body on this one. So OML perpendicular 2. I'm exiting the acanthion. Marker, good to go. So that's going to be for the rami and the body. So on the second one, it says for the body of the mandible, place the nose and chin against the IR and center perpendicular to the level of the lips. So right there, nose and chin against the image receptor right there. And then I'm going to center perpendicular to the lips. So just a little bit. Column A on this one, especially column A a little bit down, just a little bit, because I'm just getting the mandible right there. So that's going to be for the body. So you can relax if you need to. So first one, seated erect. Place the patient's head on the lateral position, IPL perpendicular, with the mouth closed and teeth together. Extend the chin and rotate the head so that the region of interest is parallel with the plane of the image receptor. So this one, axiolateral oblique. Depending how you turn, if you're a true lateral, it's for the rami. If you're at 30 degrees, it's for the body. 45 degrees is for the symphysis. Use a 25-degree cephalic tube angle and center to the mandibular region of interest. It says if you can't get the shoulders out of the way, tilt the top of the head and angle it 10. Tilt the top of the head 15 and angle it 10. easily you're gonna throw it up so much, even if it looks like the shoulder's in the way, it's gonna throw it up high enough that it'll be okay. So on this one, it does say, you know, on this one, there's kind of 3 on this one. So if I'm straight, it's for the rami, 30, it's for the body, 45, it's for the symphysis. It does say center to the area of interest, but to make it easier, and actually what they do in the book, on all these, they center the gonion, because that's basically the middle of the mandible right there. So we're just gonna angle 25 and center to the gonion. So it does say mandibular region of interest, but if you really look at pictures in the book, on all of them, they're centered to the gonion. So this is gonna be a 25-degree go ahead and get that lateral position for me, takes me this way. That one just a little bit more. Good. So I'm going to center. Step back just a little bit. So center to the gonion right there. Just a hair. Tilt your chin up just a little bit. So it does kind of look like the shoulder's in the way a little bit, but honestly, once you throw that up, it should be good to go. So, yeah, okay. So, bring it forward just a little bit. So, I have my 25-degree angle. I'm centered on his gonion, rami, body, gonion. So right now, I'll go down just a hair. So right now, he's in true lateral position, so this shows the rami. Tilt your chin, tilt your head towards the board a little bit more, probably a bit more. So 30, that's going to be the body. And you turn your head a little bit more into the board, a little bit more. There's your 45. Yeah. Feel just a little bit. Bring that shoulder down for me. Yeah, there we go. So there's gonna be for the symphysis. So 45, so there was for the rami, for the body, for the symphysis. Still all centered at that gonion. So really, when he lowered his shoulder, I mean, it really got out of the way, you're gonna pop it up. So that's the axiolateral obliques. So if it's straight for the rami, tilted 30 towards the board, body 45 towards the board, that's for the symphysis. I'm not going to do the SMV again. We really already did that. When you go through and read that, I just want to give y'all much time I can practice. When you go through that, when we did it before, it was 3.5 inches anterior to the EAM. This one, you just go right between the gonions on that one. So basically going right through your mandible. So here's the gonions. When I center, it's going to be right there. So I'm not going to go through that one again. So the TMJs. So TMJs got the axiolateral, axiolateral oblique, and the AP axial. So AP axial, to my shoulder lengthwise, patient's seated, supine or seated erect, OML perpendicular. So this one 30-degree caudal angle, midway between the TMJs, approximately 3.5 inches above the nasion. So on this one, I am going to do a 35-degree caudal angle. down for me? Can you get your head back closer to your head? So, on this one, try to get the OML as perpendicular as possible. Can you keep your head like this, tilt down just a hair more? Okay. So on this one, I'm gonna go 3 inches above the Nasion. So 1, 2, 3. Boards behind it just a little bit more. So on this one, basically, it's 3 inches above the Nasion. I might have went a little bit lower, but I'm looking at that line and I'm going right through that TMJ right there. So on this one, I'm 35 degrees column. This one, OML perpendicular. His is a little bit more IOML, but I'm gonna try to just get them as far down as possible. So 35 degrees caudal, going right through those TMJs. Pretty tight collimation, because there's TMJs on both sides. So I collimated down pretty small, top to bottom, left marker. Yeah, it's going through like right there. Yeah, right through that TMJ.
So it's a test and we get like the towns and the person can't go down like make a OML perpendicular.
Do the IOML.
Do that.
And
So you do the 37.
37.
Okay.
This one didn't really have
Yeah.
an alternative,
Just-
so I'm just gonna try to get him as far down as possible for negative 35.
Okay.
So on this one, technically, I'm not gonna make you do that in lab, but for TMJs, you always do pictures open mouth and closed, because things can look fine when they're closed, and you open, and it doesn't go exactly where it's supposed to. We'll talk about more in class, so you always do open and close on TMJs. Yeah, axiolateral. So on this one, axiolateral, says 10 by 12 crosswise in the Bucky. Honestly, when I get it in there, collimation's gonna be very small. So position of the patient erect or semi-prone, mid-sagittal plane parallel, IPL perpendicular, angle between 25 to 30 degrees caudal. So basically, when I did that first one, it was 35. This one's gonna be, says 25 to 30, but I've angled this one 25, and then the last one we did is 15. So I'm just gonna go down 35, 25, 15, just to make it easy, even though it's a lot. So on this one, 35 degrees caudal, center to this TMJ of the downside, and then 1/2 inch anterior and 2 inches superior to the EAM. Same thing for the open and closed mouth. So on this one,
Is this one that you would do both laterals?
yes, for sure. Because this one I'm really just getting your left and then, yeah. So, 1.5 inch anterior, 2 inches superior to the EAM. So, turn that way just a little bit if you do need to turn it that way. That way just take a little more. So 1/2 inch anterior and 2 inches superior. Okay. I'm tweaking it just a little bit because it says 1/2 inch anterior to 2 inches superior to the upside EAM. On hand, I wanted to go a little bit higher, so I'm actually going through that TMJ. So I'm gonna tweak it just a little bit because when I do 2 inches and go down, it's not going right through that TMJ. So I'm gonna tweak that just a little bit.
The TMJ is it that high though? I mean, It's at the top of your.
It's at an angle, so I'm looking at the downside TMJ.
Oh, I see,
I'm
I see.
looking at that line going right through his
Yeah,
TMJ
you're right.
right there. So,
Okay.
might be about 2.5. So, I'll make pretty tight on that, just enough room for my marker right there. So I might have been a little higher than 2 inches. There's 1/2 inch. 1, 2. I might be 2.5 inches right now. But if I look, it's going boom right through that downside TMJ. So that's why, like I said, it looks weird from your angle. You're like, I'm not.
Right.
But it's going down at an angle, so that line is right there. So this one, 45, 1/2 inch, 2 inches. I honestly would just look, make sure that's going right through that downside TMJ. Hold your breath, expose on that one. You see how that line's going right through that TMJ. And then the last one, axial lateral oblique. On this one, AML should be placed parallel to the transverse axis of the IR. So on this one, AML parallel, so I want to tilt the chin up a little bit. It says the mid-sagittal plane should be angled 15 degrees towards the IR, IPL adjusted perpendicular. So on this one, it's going to enter 15 degrees caudal, the downside TMJ, 1/2 inch, 1.5 superior to the EAM. Same thing, open and closed mouth. So this one's going to be 15. So this one I angle 15 and he turns his head 15. So go ahead and get back straight. Turn that way just a little bit. Don't tilt your head, just kind of like true lateral on this. Turn that way just a hair. So what I'm going to do is rotate your head in just a hair that way. Keep going. 15 degrees. So there's straight. I rotated him in 15 degrees. Right there. 1.5 inches above. Forward just a little bit. So this one, I'm angle 15, they're straight, he's turned in just a little bit, it's going down that downside TMJ, now we're 1.5 inches above that EAM.
Do you really want a tight collimation? Because it's, what is it even at right now? It's very small.
I'm basically just going, have enough room for my marker right there, so
Okay.
I'm right there and have enough room for my marker
Okay.
right there, so, step a half cent.
Wow.
So, I'm just gonna look at that downside TMJ.
We're always so worried about small collimation that we're gonna cut something off and
Yeah.
it'll repeat.
I mean, you're really just getting that little dot on the other side, so I'm really just collimating down pretty tight, have it far enough open for my marker.
Okay.
You can relax if you need to. So, all those, so that one was the first axial, for the first axial lateral, you're straight, 1.5 inches, 2 inches above. That one, angle 15, turn 15, 1.5 above the EAM. Main thing you're looking at on those last two is going into that downside downside TMJ.
Nice.
A lot of angles on that. So, there's only one on the nasal bone, so basically said there'll be a nasal bone series, so lateral, 10 by 12 crosswise, tabletop, so I'll show a different way, do that in a second. IR should be placed on the tabletop, we're not gonna do it that way exactly. You center 1/2 inch, or half of the IR should be shielded with lead. So it's adjust the mid-sagittal plane parallel, IML perpendicular, mid-sagittal plane parallel, IML parallel, IPL perpendicular, like a true lateral. I center 1/2 inch distal to the nasion, so here's my nasion right there. I go 1/2 inch distal, so it's boom, right on that nasal bone right there. Collimation's gonna be pretty tight, just getting the tiny little nose. So basically, collimate 3 by 3, build should extend from the glabella to 1 inch inferior to the acanthion, so about the lips, and 1/2 inch beyond the nose the tip of the nose. So, how I do this one, because you normally do it tabletop, so kind of a trick on this one is I'm gonna pull out the image receptor and do it on the image receptor. So it's like tabletop but standing up. So,
That's bizarre. Do you need me to move the tray? You're good. You're good.
so I'm gonna pull this out and then he's gonna be like this. So I'm basically doing a tabletop standing up. If you really think about, I mean, everything we're doing now is kind of your big head. This is doing just like a tiny nose right here. That's all I'm doing. So basically when I do a nose, I use about the same technique as I do for like a wrist. I mean, they're about the same thickness. So I use a tabletop, maybe about 55 and 5 or something like that. So now, I just do want to make sure now that I'm doing tabletop, I do just want to make sure to check my distance. So if you go ahead, let's go ahead and kind of face this way. And then turn like that way just a little bit. So I'm gonna center 1/2 inch distal to the nasion, back up just a hair. So y'all see that? The dot's very big in this room, but y'all see it's like right coming right there on him. So I'm gonna collimate to the glabella, to the lips. So I do need to open them a little bit bigger to get the lips. And then I'm just going to collimate down to the tiny little nose. And then the deferent for my marker. Turn that way just a little bit. So there's my nose right there. So 1 inch distal to the nasion, tight collimation, about to the lips, and deferent for my marker. And then, so that's doing the left. The other way would be the right.
Nice.
Can you point out again what you're calling the nasion? Just for my reference.
Nasion, like the bridge of the nose. So I'm
Okay.
centering 1/2 inch posterior to the nasion. Boom, right there, right on those nasal bones. So that's an easy way to do it standing up. Pull it out, center to that. So that's the only one for the nasal bones. You would do both sides for comparison, and normally in the nasal bones you do the waters, but we've done the waters multiple times. So last one, zygomatic arches, apiaxial. So unilateral tangential. So this one's kind of weird. This is temporal crosswise of the bucky. Patient AP, extend the head back to rest on the vertex for tangential. Only one arch, rotate the mid-sagittal plane 15 degrees towards the side of interest, tilt the top of the head 15 degrees away from the side of interest.
What?
We'll get there. This is send the eye arch to the zygomatic arch being examined. Central ray should be perpendicular to the IOML and approximately 1 inch posterior to the outer canthus. It's basically just going to skim that zygomatic arch on this one. So this one is going to be basically a modified S&B. So, go ahead, you're kind of already in the position I need, but I kind of want to go from step 1. So go ahead and bring your head back in on an S and B. So if I was doing his left zygomatic arch, basically I'm going to rotate towards, tilt the top of the head away. That's going to stick out that TMJ right there. I'm going to scoot you just a little bit, scoot just a little bit that way.
that?
Let's go for some too.
So this one, light is a little hard to see, but y'all see the lines right there? They're like coming right there. So it's gonna be 1 inch posterior to the outer canvas, right there. I basically collimate to the side of the space right there, and then have my marker right there. So that beam is just like skimming his part right there. Just here.
See what it's like right there.
Yeah, it's coming like this, like skimming that part right there. So you need to relax for a second.
No.
Okay, go ahead and kind of go back to SMB again. So on this one, you rotate towards, tilt away. So that's kind of tilting. Rotate, tilt the top of the head away, and then it skims that part. So it's skimming that part right there, that zygomatic arch right there. So you kind of see that right there. It's skimming that part.
Yeah.
You can relax if you need to. So here's someone's head. You rotate towards, tilt away. If I was doing his left side, I would rotate, or sorry, his right side, I would rotate towards, tilt the back of the head away.
Rotate the whole head and then tilt. Tilt.
Rotate to the
Yeah,
side
but your
of the
SMB, you need to do SMB when you do, yeah.
Something you probably just have to do.
How? Yeah.
Tilt your head back. So rotate towards, tilt back. Tilt the top of the head away.
Okay.
So that's gonna pop out that little cheekbone right there.
You should practice your stomach
Yeah. So when you do it, 1 inch posterior to the outer canvas, it's really gonna skim. It's a tangential, so it's gonna skim that.